Welcome to the podcast. Paul Morrow here, another
Thank you.
edition of Smart Financial Lifestyles. And we're going to talk about Medicare because it is a stress ball in 2025. We're happy to have Joanne with us. I'm going to have her talk a little bit about her business and where she is and all that. And then we'll dive deep into some of the minutia of this difficult time. Give me a little rundown. Your firm's been around a long time. I can tell from going online. Give us the 3x5 card on Giardini Medicare.
I love it. The 3x5 is very simple. We got into Medicare formally in 2018 in our own agency. It's a family agency. So my son is 32. He helps me run it. My daughter's an agent. We've got 10 of us. It's great. It's just we decided in 2018, just because it's such a crazy industry, and we just didn't feel it was done a lot of times in the right way, like giant call centers and such. We're just going to go create it and do it ourselves. So that's what we did. So that's when we became our own agency. All we do is Medicare. So, you do 24/7 Medicare for all these years, you start to know Medicare, right? So, that's it. It's a crazy industry. As you know, we were
Yeah.
just chatting about stress and all sorts of things. So let's just jump into all that
Yeah. So
stuff.
you're Michigan based. You started in Michigan,
Michigan
correct?
based. Yeah,
Yeah.
Michigan.
Yeah. And I assume you work in a lot of different states.
22 states, currently 22 states, the classic retiree states, right? Florida,
Florida.
Arizona,
Yeah. Okay.
California,
Got it.
Carolinas. Yeah,
But you're
Midwest is
doing
our
a great
hub.
job online. I have to say,
Thanks.
I sold my financial investment practice about 2 years
Mhm.
ago, went into this
Mm.
education business, wrote a few books, whatever.
Mm.
And I have to say, there is a huge shortage of just plain education in this area. In
Yeah,
fact, yeah, I have to say also, I think there's a huge shortage of financial education in general, but that's another whole topic.
there
Um,
is.
so
Yeah,
that's why you did it. And I can
yeah.
see it's a family business. That's how you're doing it. It's
Mhm.
AEP, it's the annual enrollment period. Tell me what you think this year will be like compared to past years.
You know what I'm seeing actually, and just did a TikTok recorded this morning about it, is I'm seeing a lot of employer plans are finally, the employer can't take those increases on the employer plans any longer. So we're actually seeing quite a few people saying, hey, my plan just doubled at my workplace. I'm 67. Should I go to Medicare? That's super interesting because we haven't really seen it. We've seen this deluge of over the last couple of years. Everything pricing is just getting more expensive. Healthcare across the board, whether it's ACA, Medicare, employer, everything is just getting pricier for the consumers. So that's been a lot of our discussions for the last couple of years. So we created even some websites that are just directed towards the people that are working still. Because one of the big questions is, hey, I'm turning 65 and I'm still working. What do I have to do? As you know from all your studies, people are working longer, right? So
Absolutely.
they
The
don't have
fastest
to go to
growing
Medicare.
part of the workforce is the 70 and over.
Yes.
Incredible.
And so they don't have to go to Medicare necessarily,
Yep.
but maybe they should. And now they're saying this is the first year I'm really noticing they're like, oh, my employer plan doubled. I got to get off of here and go to Medicare. So we're seeing that. We're seeing a lot of insurance companies just downright getting rid of PPO plans. Like 2 million people are affected this year. So you get a lot of, my dad's 92. He lost his plan. It's stressing the whole family out. And he needs to figure out what to do. And then we're seeing just the regular stuff, but it's a tougher year because you've got insurance companies squeezing agents like they really are. They're really trying to get rid of agents and they're making it pretty apparent. So
Yeah.
you've got no compensation for the people that are supposed to be helping the public, right? So people are starting to say like, well, nobody will help me. I've been trying to call an insurance company for 4 hours. I can't get through. Medicare doesn't yet. It's just it's a bad year. And then you've got, and we were talking for a minute about the numbers of people. There's 63 million people on Medicare right now. In 5 years, there's going to be 79 million people. So you've got this, right?
It's
This
a huge number.
crazy
I mean, the
universe that's going
longevity
to
thing is
happen.
really impacting the usage.
Yeah.
It's impacting the
Yeah.
usage. But at the
Yeah.
same time, I'm not quite sure what the theory is behind this, other than saving a few bucks. Because actually, and this is a public, podcast that's going to be out there. I mean, actually, Medicare agents don't make that much money
They,
that they would actually
right.
make plans non-commissionable, which means
Mhm.
to the public that's listening, that means that if an agent helps you, they don't get paid. Nobody expects folks not to get paid. I mean, when you look at the numbers, it's
Right.
insane that some of these
Right.
companies have made half their plans non-commissionable. That's crazy. All right.
Hmm. It
So
is.
also, I
Hmm.
have to say, the whole pre-approval thing is being launched by Medicare
Hmm.
in those 6 states. Tell me what you
Yeah.
think about that. That's a weird move.
It's a weird move, but I don't know if it's going to materialize. It's getting some pushback now. So what they're doing is they're saying, hey, in 6 different states, we're going to have a pilot program with 17 procedures that are supposedly highly abused, supposedly. And in, a prior approval is okay if it's not abused. It's when it's not a cost saving effort by an insurance plan to save things, right? I don't know. So you can look at it both ways, but I don't know that it's going to happen. But I also the cynical part of me is wondering, it's like, is that just the preamble to Medicare Advantage for all,
Yeah,
ultimately, right? In
right.
5 to 10 years, is that where we're going as a country? Which I hope not, but nothing surprises me these days. Let's put it that way.
Yeah, the choice thing is really big, and I think for a lot of folks, the reason they stay on traditional Medicare is it's a no-brainer. They walk in, the
Yeah,
doctors take it, they get their treatment. It's like you don't have to think about it. But now, if you're in certain
right.
states, you do have to think about it, right? And
Hmm.
so again, the
Hmm.
more thinking, the more
Hmm.
stress, the more whatever. Okay, so
Hmm.
I also,
Yeah.
again, having been in this industry for a long time, I know that a lot of insurance companies in every area, disability, health. I mean, they maintain a
Hmm.
conservation department. I mean, it's basically the
Hmm.
no department. I mean, their first
Hmm.
job
Right.
is to, like, the famous
Hmm.
case with Union Mutual or now Unum, declining claims was the first thing they were supposed to do.
Hmm.
So tell me, do you feel like this is going to be much more impactful for the lower income clientele? The affluent always seem to get everything they want. Um, tell me how you feel it's going to play out for, let's just say, the two Americas. There's the affluent group of Americas, and then there's the regular working slobs like us, right? So,
Yeah, right. Yeah, and it's funny, and both of them kind of act the same sometimes. It's so funny. So it's like if the wealthy people have to pay $300, they're appalled because they're supposed to be paying for the Cadillac. Well, you are, but you still have some copays, but they're still appalled, right? And they can afford it. So it's, tough problem to have. But then you've got the people that unfortunately have gone into maybe Medicare Advantage because they can't afford a supplement, they can't afford it, and that's a real thing. There's a large portion of our country that can't afford a supplement. They have to take Medicare Advantage. They also presume or fall for the commercials thinking everything is free. So when they're going to use their plan, what do you mean I have a deductible? My doctor didn't tell me that. Oh my gosh, I can't pay $300. So it's like you've got both crowds complaining about the $300, right? One can well afford it, one can't, but they didn't understand their plan, which is why the whole push towards education is just huge. It's just if you're coming into Medicare, you got to understand the rules. How do you get out of the plan? Can you get out of the plan? Can you not? What state do you live in? All those things. How do you protect yourself? Can you buy other ancillary stuff to help yourself? It's just very, very challenging for both. Um, the wealthy, yes, they can afford it, but they don't want to afford it. How about that?
yeah,
It's
no, it
expensive
seems
for
to
them
be.
too.
Yeah, but
Yeah.
in New England, I will tell you, so we've practiced pretty much up and down the Eastern Seaboard from,
Yep.
Portland, Maine down to Florida, wherever, over the years. I have to say, I cannot believe how many affluent senior citizens end up with concierge medicine. I mean, they just say they give some
Yeah.
doctor 10,000 bucks. I want to join. It's like joining the golf club or joining whatever. I want to make sure I have access. I want to make sure, and I don't care whether they take insurance. I mean, that's a little bit of a disturbing trend, which means the more money you have, the longer you live. It's kind of weird, right? But we seem
I
to,
do that. I have direct primary care. Direct primary care is it's not a concierge. It's not a 10 grand a year. Mine is
yeah.
$60 a month. But I do it just for access too. It's like when I want something, I want to text my doctor.
Well,
And I
you're in
love
that
it.
other group, Joanne. You're in the other group we're
I'm
talking.
not there. I'm not there. Remember, Medicare agents don't make that much, but no, it's just a convenience factor. And that's what our healthcare, I think, used to be, right? 15, 20 years ago, we didn't have the garbage we do today. It's not a
Yeah.
good system. If you're asking me, we put policies in place to best fit the system, but I don't find our healthcare to be a great system in this country by any means.
Yeah, it's interesting. So as I said before, we were talking, I'm married to a Canadian. So of course I get to hear this
Right.
when I go
True.
visit Linda's family from Vancouver to Newfoundland.
Hmm.
And they've had every disease you can imagine. So you have a huge Canadian family, right? And they look down over the 48th parallel and they say, what the hell is wrong with you guys? I mean,
Right.
it's so splintered, it's
Yeah.
so divisive. And again,
Yeah.
having been in the insurance industry a long time, we all
Right.
know that the bigger the numbers that you spread the risk among, the better it works out. And yet we have
Hmm.
50 states with 50 little insurance commissioners and 50 plans, and
Hmm.
then slice and dice that even more by zip code. It's like the more splintered we get it, the worse the system works. So, I mean,
Correct. Right.
insurance is state regulated. A lot of people don't know that. They think it's federally regulated. It's not really
Hmm.
true. It's state regulated. I mean, which
Hmm.
I think was a mistake in the beginning, but that's coming home to roost now for a lot
Yeah.
of people, small group, right? Tell me how you think this year, 2025, is going to play
Hmm.
out for the Medicare supplement business as opposed to the Medicare Advantage and all that.
It's a great question. I actually see a lot more interest in going to Medicare supplements, a lot more this year. I think you've got a lot of bad press out there. You've got United Healthcare in the headlines. You've got the no, the denials, the Luigi, you've got all these
Yeah.
things that this is the biggest year that I'm seeing people really want to get off of those Advantage plans. And I don't know if it's partially because probably the last 5 years, I would say you've got a lot of blasting education. You've got the YouTubes and the TikToks that have really grown. So there's a lot of people that are pretty informed. There's a subset that are, and there's a huge subset that are not. But the ones that are really saying, hey, I had no idea what I bought 3 years ago. I've since figured it out via all these channels. I want Medicare. I want original Medicare. So I think you're going to see maybe the first year, maybe non-growth in Medicare Advantage. I don't know. It's interesting because people a year or two had thought would have, supplements were dead. 70% of our business is supplements. We do a lot of
Really?
supplements.
Interesting. And you
Lots.
have, do you have confidence that there will be just as many companies offering product? Because I noticed that we had a lot of clients that were on either United Healthcare or Aetna or whatever.
Yeah.
They're not offering their product in their zip code anymore. But with Medicare supplements, do you still find a lot of available companies and products with
Hmm.
quality companies?
You do. Probably if you pull up Michigan, there's probably 30 or 40 options. Yeah, in most
Wow.
in most states there's a lot. So it's the Advantage plans are getting pulled by zip code. The supplements are existing. Now some are going out, like Allstate tried for 5 years and they just closed up shop. So you've got some of those companies, but we're not using those kind of companies or not. We're typically doing the Uniteds, the Aetnas, the Mutual, the big companies.
Yeah.
And we have to just tell people like, look, if you want a supplement, they're fantastic. You're going to pay for it. It's going to go up 15, 20% potentially. We don't know, but you're paying for that freedom and that luxury, kind of like concierge, unfortunately.
Yeah. Right.
It's what you're buying. You're buying your freedom with that. And it sounds terrible, but it's just reality of our system.
Yeah, tell me
Again,
about
which I don't think
Michigan.
is a great system. Yeah.
Our home base is in Massachusetts, so we have all these great
Hmm.
guaranteed issue things and all that stuff.
Right.
Really kind of unusually great, right? So,
Right.
yeah.
Right.
What's it like in Michigan? If people want
Yeah,
to,
we talk about you guys. We talk about Massachusetts, Connecticut, and New York. Like you're like if you live there, don't even listen to what I'm saying because it doesn't apply to you. But in Michigan, it's very different. So if someone's coming into Medicare for the first time, they got to be pretty careful because this is a long-term decision. They are stuck unless they can pass medical underwriting. You've got 6 months in the beginning to just pick what you want. If you don't get the right product, and all of a sudden 4 years later you want to change, if you had a stent put in 2 months ago, you're not going to pass. You can't have it. So it's a long you're stuck. You're stuck. So it's important to get as much as you can the correct carrier. No agent, nobody out there is ever going to get perfect. It's perfection's not a thing with Medicare.
yeah,
It's
yeah,
just not. Get directionally accurate. Have an agent that can walk you through the basic stuff and answer your questions when you need them. That's to me the key thing of using an agent. But most states are like Michigan. You've got about a dozen with birthday rules, anniversary rules, and those are different too. Like California, you've got a birthday rule. So big deal. Get in a plan G, and if you want to change every year, you can change at your birthday. More like Massachusetts
yeah.
and stuff. But we don't have any special rules here. It's actually been shot down a couple times. They keep introducing it and it keeps saying they just say no, which is
Interesting.
interesting.
Tell me
Yeah.
about is it true, a little silver lining to what's going on? Is it true that for anyone whose plan is canceled, let's say United sends you a letter that says you're done, don't you have a guaranteed issue right to get into a Medicare
Yeah.
supplement plan? That's a silver
Yeah.
lining, which I wanted to
It
bring
is.
up because of the
It
people that
is.
are stressed,
Yeah.
there's a silver lining here, right?
Yeah. Yeah. And it's kind of like when they say, oh my gosh, my plan's leaving or my dad's plan's leaving. It's like, congrats. It's like this is your ticket. This is
Yeah.
your get out of jail free card. So we give them that option and regardless of what state, because a lot of times agents don't get paid for guarantee issue business. So you've got a 90-year-old that wants a guaranteed issue plan F. We don't get paid on that. So what we do is we give them the rates. Here's my suggestion. I would take this company. Here's what to do. Here's exactly what to do. Make your phone calls and get the plan in place. But those are unique for the family, I think. We always try and frame it with like, look, if dad is 90, guess who's going to be dealing with the hassles of everything if you have poor health care when he falls and goes to skilled nursing,
The
right?
oldest daughter.
It's Correct. Exactly. That's what I am. Exactly. So
Exactly.
it's just, split
Yeah.
it up. I mean, have the kids, you know what I mean? If the kids can, it's just, my parents both have fabulous insurance and they will never not have fabulous. And it's because it's going to fall on me. So that's important for the family to understand their options versus just saying, hey, I'm going to call 1-800 Medicare and get a new plan for dad. And all of a sudden it's just a new HMO that they just slot them into just because if you call Medicare, they're not going to tell you that you have guarantee issue options. They just aren't going to tell you.
Yeah.
So that's where people really get hurt, really, really get hurt.
Yeah, we're not a really big fan of the huge call centers. I won't name any of them, but they're just like I mean, every sports star that's retired seems to be doing ads, in
Yeah,
Massachusetts, you know,
yeah,
and it is a little bit overwhelming, but also very effective. I mean, they
yes,
break all the rules that you could break, and
absolutely.
they consider it a cost of business that they're going to pay some fine or penalty someday. It's not
Yep,
even really like important to them. Uh,
correct.
and it's probably the most harmful thing we think. That's why, again, I'm
Mhm.
so happy that you joined me because our big thing for 50 years is go to professionals who know what they're doing. I mean,
Mhm.
that's been with our firm
For sure.
policy. It's the reason that we support other professionals around the country. Tell me, uh, I know that you focus quite a bit on short-term home care.
Yeah,
And I think it's a
yeah,
real big deal. So can you just
yeah,
like describe that a little
sure.
bit? Because, and I'll tell you why, I think it's page 35 of Medicare and You always has this
Nice.
little paragraph in there about how you can get 35 hours of home care from Medicare
Yeah,
or
yeah,
try and get it.
yeah,
Anyway,
yeah. Try, exactly,
I mean,
exactly. Try and get it. My daughter-in-law's a physical therapist, a home physical therapist. So
okay.
she goes through that stuff and says, no, it's not reality. So yeah, and unfortunately, it's not available in Massachusetts, which is the bummer. A lot of the East Coast, it's called short-term care.
Yeah.
And short-term care is unlike it's just like long-term care, except in terms of the triggers. The triggers are two of the six activities of daily living. So it's the same chassis. The difference is duration of the benefit. So under 1 year is short-term care, over a year is long-term care. It's just the chassis it's built on.
Okay.
So that's what I love about it is just that this is not new. It's just short-term and care in nature. And I will tell you, I've asked hundreds of financial folks in the last couple of weeks as I do webinars for these guys, who has ever heard of it? And one person so far has said I've heard of it, which is
Two.
astounding. Two, okay, two. You're the second, but it's astounding. And then people on TikTok are like, "Oh, I go back to my financial person; they've never heard of this." But it's just like long-term care. The difference is the duration. So you can buy up to 1 year of a benefit. You can buy cash. You're buying cash, and it's 1,200 a week. It depends on the level you're purchasing. The difference is it's reasonable. I bought myself one, and when I was 59, I bought it for $75 a month. I get $1,200 cash per week. Then I'm on claim. So that's what's that, 4,800 a month, up to a year. And then if I'm good for 2 years and then I had a stroke or something down the road, I can use another year. So it actually replenishes itself one time. And the other big difference to me is that it's there immediately. So lots of long-term care people will buy a plan with a 6 month elimination period or 1 year elimination period. What are you going to do day one when you have something happen? So it's easier to qualify for. It's far cheaper than long-term care. The rates are pretty well locked. They've never had a rate increase since 1996, which is pretty amazing, unlike traditional long-term care.
Mhm.
And the big thing is we just have so many people over the years coming to us and saying, my dad fell. He's 88. He needs someone to watch him from 4 to 6 o'clock, right? He fell. He needs help bathing from 6 to 7. It's either the family's going to step up being that oldest daughter or somebody in the family or you're private paying, but they all expect Medicare to come in and pay for that.
Oh yeah.
It's not going to pay for that. Look
Yeah.
at look at page 35 and I get it.
Yeah.
They might do some medically necessary in-home care. They're not going to come bathe your dad.
Yeah, the
Sorry.
real issue is that, you have to use a Medicare approved agency. And I will just tell you, in the New England states, Massachusetts, Connecticut, Rhode Island,
Hmm.
whatever, I mean, forget it. I mean, these agencies want to make money and they can't make
Right.
money at the rates that Medicare would pay them. So guess what? They say, well, we're not doing that. We're not a Medicare.
Right.
So this is
Yep.
important because, I will tell you that over the years of doing wealth management for people,
Hmm.
we have always had this expression that late life healthcare cost management is wealth management because if you
Yes.
don't pay attention to it, it chews a huge hole out of your budget. So
Hmm.
the home care thing's a big deal. I think in
Yeah.
Massachusetts, there's one company that will still write a 1 year only long-term
Mm,
care, whatever, 365 policy. That's about it, you know.
mm.
But we have a very difficult insurance commissioner here. I mean, really. Now there are some good things about Massachusetts, but um,
Right.
not every
Right.
not every company gets into Massachusetts for their product, you know.
Yeah. Yeah. We're not licensed in Massachusetts, and it's okay.
Save the fees.
It's
I mean,
okay. Yeah.
okay, sorry.
Yeah.
Whoops.
Oh, yeah. It's expensive too. Right.
Yeah, right. Save the fees. So let's talk about that. So Medicare, and again,
Mhm.
you know this and I know this, but it's probably important for us to say this that Medicare insurance coverage, whether it's a supplement or an advantage, whatever. I mean, these things don't pay for any institutionalized care, long-term care,
Mhm.
home care, which according to our wonderful Boston College around the corner here from where I'm sitting, their Center for Retirement Research, I mean, they've upped their number big
Yeah.
time. Big time. The out of pocket per couple now is approaching $500,000
That's amazing.
for
Wow.
retiree healthcare costs without long-term care. You're talking
Wow.
about prescriptions, deductibles, out of pockets, premiums, all that. Alicia Monell, the doctor of her PhD is in this area of medical coverage and cost and actuarials. Uh,
Mm,
I mean, she's upped her number because everything has gone up so dramatically,
it
right?
has.
That
It
if you don't pay
has.
attention, I mean, half a million
Mhm.
dollars, it might not be a lot to some affluent clients, but that's like half of some people's retirement fund. That's a
It's a
substantial
lot.
number, right?
It's a
So
lot. And I agree with that. We've been seeing the same thing. Like I said, that whole floating up of cost. And then people get mad, like, well, I shouldn't have to buy a cancer policy. Cancer should be 100% covered. I'm like, okay, but they're not going to pay for your plane trip to MD Anderson. I don't care what medical insurance you have, no one's paying for that. So
yeah,
it's everything is just very expensive. We don't have answers for that. We have coverage we can give you, and it's
yeah.
all we can do.
And I know you sell some ancillary coverages because I've heard you
Yeah.
talk and followed YouTube. And I'll tell you
Yeah.
just two quick stories, which I think that if people are listening, will be a good reason for them to call Joanne and Giardini Medicare because they do these things. So we had a retiree couple, wonderful long-term clients of the wealth management firm,
Mhm.
and they just saved up their whole life and they retired and they took the cruise of their life, fly to Rome, go to the Mediterranean, do all that stuff.
Oh,
She had a heart attack the first night
oh God.
on the dance floor, somewhere in the middle of the Mediterranean. They medevaced her off the tail of the ship with a helicopter to, I think, Croatia, and then they did emergency surgery in London. Anyway,
Mhm.
so the good news is they saved her life, but I think it chewed about an $80,000 hole in their pocket because number one, they didn't have health care that covered it. They didn't buy
Right.
trip insurance that
Life
covered it.
insurance.
They didn't
Right.
they didn't spend
Wow.
$180 for an air evacuation. But I mean,
I know.
it's like these details are like really significant
Yeah.
details
Yeah.
because you do
They
have,
are.
and again, it plays into the active, larger group of retirees that are, guess what? They're not sitting around watching the NFL drinking Budweisers. I mean, they're traveling, right?
Right.
They're
As they
all
should
over
be.
the world,
That's
right?
fine. Just get trip insurance. You're right. It's a couple hundred
I
dollars
mean, it's
on your
nothing.
$18,000 trip. It's nothing. Exactly. Your trip to Africa safari.
Oh my
Great.
God. I
Yeah,
went to our travel
it's
doctor
crazy.
and we have a travel doctor here at the University of Massachusetts
Oh.
doctor. And so we're getting our shots to go to Africa a couple of years ago. And she was wonderful, all the shots for this and that, and she looked at our trip pattern. We gave her the list of the countries and she says, okay, this is good here and this is good in Botswana, and this is good here. She says, when you're in Ethiopia, don't eat anything, don't drink the water, don't touch anything because there's nothing
Yeah.
I can give you, right?
Right.
That's going to
Right.
make you
Right.
100% safe. World travel is a big deal. So I know
Yes.
I'm on a, I'm on Medicare. I'm a bit older than you are, right? And I've done some traveling. So I mean,
Yeah. It's awesome.
having coverage that covers you anywhere in the world is really important. And the premiums are insignificant compared to the amount
They
of
are.
risk involved. Okay. So
They are. They
tell me
are.
about one more thing.
Yep.
We work with a lot of attorneys around New England, especially, and Medicaid planning has been a big business for about the last 25 years. And to be uh, pointed about it. Medicaid planning was professionals making rich people look like they're poor so the rest of us can pay their bills. Okay. So yeah,
Right.
you know,
Right.
I think from that you can tell what my opinion is about that. But
Yep.
so we interviewed some of these attorneys recently with some of the changes in
Hmm.
these social network programs. they feel like that industry is going away entirely. And now, do you work with a lot of people that are dually eligible?
We actually don't. We
Okay.
actually don't, and especially intrastate, we don't because it's bad enough in Michigan trying to. I just think that's a huge specialty amongst itself. So we've got Medicaid, Medicare duals,
Mhm.
dually eligible folks, which is what that is,
Yeah.
that are in Michigan that we just refer to, and we just love experts in their lane.
Yeah.
So you could break Medicare into duals and non-duals. So we tend to work with lots of financial folks across the country. That's kind of where we started.
Yeah.
So we have people that if 70% of supplements, they're not dual, right? So when we get a dual, we just ship it off to the people. If because of some of those programs are going to change and if that can be stopped, because I do think it's horrible to have someone with $10 million of assets on Medicaid. I just don't think it's appropriate. That's my thought, but
Well,
that's a good thing.
a lot of lawyers
I
made a
get
lot
it.
of
It's
money.
all legal.
Yeah.
Correct.
Yeah. A lot of lawyers made a lot of money doing that. Yeah. Anyway, so yeah, I wanted to get your opinion on that because we, again, as I said, I think these a lot of changes are going to impact the
Hmm.
least able to pay. We just had a
Yeah.
woman I saw this weekend at a social function, a long-term client of ours, whatever. Her husband is actually in a nursing home in Massachusetts, fully paying, but they just
Hmm.
notified her that they're closing because 65% of their revenue is Medicaid based.
Right. I
They just
anticipate that.
they got a
Yeah.
14% cut and they only had a
Yeah.
3% profit margin. So do the math, right? Um,
Right.
yeah.
Right.
Give me a summary. I don't want to keep you all day, and I know we have about 8 minutes left. I don't want to like go on. What do you think are the like? Give me the top five Joanne's most important things that people should pay attention to this year, and then I'll review all the contact info about people get a hold of you. Okay, top five
Okay.
sensitive or hot topics for Medicare season this year.
Medicare season this year, it would be check your drug plans. A lot of drug plans have disappeared. A lot of pricing has changed. So we saw one in Michigan go from zero premium or 40 cents or something to $50. If you're not paying attention now, you're going to be stuck with that plan in 2026. That's huge. If you're trying to get out of that Medicare Advantage plan and you're healthy, you got to act during this window here. You do have a backup window, January, February, March, to be doing that. If you're starting Medicare now, you just have to understand what you're getting into. Medigap, Medicare supplement, same thing. Those both are the same, word for the same thing. I should say different words for the same thing. Or Medicare Advantage. Those are your two options. Get your Medicare New Handbook out. Page 10. It shows you the two paths you can take. Start there. Use an agent would be the fourth. Absolutely use an agent. Don't go to the insurance companies directly. You're never going to get the help, just the little things that you don't even realize you're going to get from your agent. It costs you nothing to work with an agent. And the fifth thing I would say is look at your short-term cares and your ancillaries. Buffer your cost as much as you can for the next 5 to 10 to 15 years. That number you mentioned, that 500 grand, it doesn't surprise me. It appalls me, but it doesn't surprise me, unfortunately. I think we could have a great healthcare system in this country if we wanted to. We just choose not to. So we have to, unfortunately, still protect ourselves. And that's just the way our world is right now.
Yeah, I would say that that's the theme, and I'm glad you sort of wrapped up with that. I mean, the theme that we're trying to get out is that you need to take care of yourself. Like number one, you need to be like the chairman of the board of the Giardini family
Hmm.
because
Right.
you can't
Right.
expect in this day and age anyway, and in this environment that
Yep.
the medical plans and all the other things driven by some politician, is not necessarily going to be the right thing for your family and your situation. You just got to really be proactive. I guess that's a
Yes,
overused word, but it's really true. So in terms
it's
of being
true.
proactive, we have always said that in order to do great wealth management, you need about 9 licenses, which includes
Hmm.
the CPA, the lawyer, the insurance guy, the investment professional, the Medicare person, whatever. And so that's the reason why we advocate using what we call professional specialists in every area
Hmm.
and building a team out. Every one of my 3 books, by the way, if anyone wants them, they can download them from Amazon for free, get the ebooks for free. Or if you're a book collector, I mean, I wrote a trilogy. My editors at Amazon said, don't write 300 pages about money. Nobody's going to read it. Do 100 pages for the grandparents, 100 pages for the X-gens, and 100 pages for the millennials. So, but in every book, it says, hire a team because you can't do it on
Yeah.
your own. There's some things you can DIY, but not this. You can't DIY
Right.
this. So, in order to reach out to a super professional on Medicare, otherwise known as you, okay, what's the best way for a person who wants to get advice, help, hire your firm, whatever? Give me the rundown.
There's a couple of things. We have our website, which is www.gmedicareteam.com. That's generic. You can set up appointments on there if you're in one of our 22 states. We have referral partners in the country that work in all 50 states, so we can get you taken care of. I would really push the TikTok and YouTubes and things like that. We have an online course. We've got a podcast. We've got everything, every way people can learn. We want them learning. So follow those. You don't necessarily have to be on the phone with people and from our office because sometimes you're too early. We had a 55-year-old recently that wants to plan for Medicare and she was angry that we wouldn't take time out of the busy season to talk now.
Yeah,
And she
yeah,
needs it in 9 years. I'm like, we can't do that. So you've got all these ways. I answer emails all the time. People can email me at Joanne at G Medicare Team. You have it, Paul, my email address. You can share that. I answer emails all the time, and then we can do a lot of back and forth. And if it's appropriate, get a phone call in.
yeah.
It's pretty straightforward.
I want to emphasize to everybody that Joanne wouldn't be here if we didn't think, and I do my own little due diligence. I mean, if we didn't think she was a qualified, ethical, honest, awesome provider of information, et cetera. And you don't need to use a Medicare person that's on the next block because in this day and
Mhm.
age, one of the good things about technology is that a person can contact you, they can have interviews by Zoom, right? They can actually engage you digitally. You can help them in the state you're licensed in. You can help them or
Right,
refer them, right? So you
right,
don't need to like feel like you have to go to the senior center and only work with someone who's, and they might be well-meaning people and they might have
right.
some knowledge, but I would say to reach a real professional, we
Yeah,
encourage everybody to reach out to us. We love
yeah,
our referral partners. We love the professionals in the financial industry because I know you've been doing YouTubes and everything since 2019. You are not a beginner at this, and so
right.
you've put your time and effort into this. So you've educated a lot of people on your nickel.
Yeah,
That's a
yeah.
really, I have to say to anybody who's
It's a
listening,
full-time job.
yeah,
Yeah. Yeah. Well, YouTube is my son's. I do the TikTok, but TikTok takes 20, 30 hours of my week. I mean,
yeah,
that's pro bono.
yeah,
That's,
yeah,
yeah. And we get lots of, hey, I learned so much. It helped me and I bought locally. That's fine. But, it's just work with a professional. I couldn't echo that more. I
yeah.
appreciate that sentiment.
All right. Hey, guess what? I'm going to give you back the
Thanks.
rest of your day. You've got TikToks to make,
Okay.
you've got YouTubes. I want to
I
thank
do.
everybody for tuning
Thanks.
in, right, to our little podcast here, Smart Financial Lifestyles, and staying in touch with quality professionals is just part of the art of being smart.